Hi, Hang. Hi, Hang.
Hi, Wendy.
Hi. Can I ask what the time is in Sydney now?
It's 11 because we're back to daylight saving now. So I was trying to sign into my GitHub and it didn't let me in. So I was like, yeah, all good.
Yeah, because it's also possible to go back to alternating schedules if that helps the Sydney team.
Yeah, I'm not sure if what the others' preferences are. I'll probably have to ask Clementine and other people, see what they like. For me, it's okay. I don't mind it too much.
No, because we cannot probably find a time which is suitable for everyone. But if we can do, for instance, alternating schedules, then at least everyone has the opportunity to join at some point.
Yeah.
Because I see that Anthony says that for him it's now 8 o'clock in the morning in New York. So if we go earlier, then it's
7 now. I moved to 8.
Okay. Yeah. But let's wait till the team from London is there too, and otherwise we will make it also an issue on GitHub.
Hi, everybody.
Hello.
Hi.
The Clem is an apology. I just saw. And yeah, we need to discuss meeting times for next year anyway, so that's a good prompt for that. All right, the recording's already started. I guess that's you, Hung. Thanks for that.
Yeah.
And I was just editing the issue just a second ago, just to add in the last few things, but I think we can probably get going and people might join as the meeting carries on. All right, so this is our slightly postpone October 2023 meeting. And I am just going to share the screen so that we can see where we're up to. Okay. All right, so here we go. Yeah, and yeah, congratulations to everyone, and being led by Wendy and team for winning the Open Science Award. That's really great. And 31 projects, that's fantastic. Hopefully you can, there's no issue with you just plowing the money back into the project or doing something else useful with it. But that's up to you, Wendy, right? It's your award. So you can do whatever you want with it.
What we were planning to do with the money was to keep Marij a little bit longer to help us with the screening of the compounds, both in vitro and in vivo.
That's good. Fantastic. Yeah, really good. Yeah, and I saw the nice photo. I think, was Mickey there? Was he the one who actually was there picking it up?
Yes, Mickey was picking it up because last week I was in Ghana, so
yeah.
I couldn't attend.
Yeah, yeah. You're like those people who win the you know, the Oscars and they can't be there in person and they have to send someone to pick it up. Yeah, it's great. Really good. Yeah, so now
I was still in China, so Mickey got the honor.
Right. Yeah, so now we are able to, rather than just say the open source so the MycetOS project, we can now say the award-winning MycetOS project.
Yeah.
Great, well deserved and fantastic. All right. Are we due later in the meeting to talk about new in vitro or in vivo screening data? Because we could postpone that until one bit later on.
Marij made a small presentation with only a few slides to summarize what we found so far.
Great.
And yeah, it's only a small presentation because all of the things come back to the different parts. So maybe it's good to do that at the start then.
Yep. Yeah, we can do that. I'll get off the screen and we can do that. Great.
Okay, then share screen. I think, right, is this the first slide?
Yes.
Yeah.
So the last few weeks I did a high-low screening of my compounds. It were 63 compounds from series 1, 2, 5, and 6, and some kinase inhibitors. The results were that 9 compounds inhibited the fungus by 100 micromolar and 25 micromolar. So I made a table of the compounds that inhibited there. You see 5 from series 6, one kinase inhibitor, 2 of series 1, and 1 of series 5, and therefore 3 compounds with the bold Myers codes were inhibited by MM55 and an FS strain, and the other ones were inhibited only by MM55. So these were my results now.
So MM55 is the Madurella isolate, and the Falciformis spora inhibited 3 extra compounds. And the plan is to do an IC50 for those 9 compounds. We have more compounds in the lab, but Marij did not test those yet because simply we needed time to dilute all of these. And well, we needed the help of Kimberly, myself to make stocks of all of these compounds. A new batch is ready now to be starting screening this week, and the final compounds we hope to dilute as well this week, so that by the next MycetOS meeting everything is screened, at least for the high-low, and for the some we will have the IC50 already. This will be uploaded this week because I need to double check the calculations before we upload.
Great. So the implication is that the other compounds didn't inhibit at 100 micromolar, or is it that some may have been 100 and didn't at 25?
Yeah, so some did inhibit at 100, but not at 25. And all the data will be uploaded this week. And
Okay.
bear in mind, it's only a subset of the compounds. Roughly half of the compounds were screened by now.
Yes.
So there's still more to come, which weren't screened yet. So we could get
Okay.
more hits out of this.
All right, great. We'll wait for the full data in that case.
And then maybe just to show one more slide. Mickey also screened the kinase library. And these were the hits we found so far. So there were 6, which inhibited at 10 micromolar. And we will do an IC50 for those 2 to see how potent they are. The rest was not inhibiting the fungus in growth. So it's only 6 for the library.
All right, that's good to know. So are we awaiting also final, I mean, final data on these, or is the kinase library done?
So this part, the high-low screening, is done.
Okay.
We only need to make a new spreadsheet to add it to the big spreadsheet, because I don't think it's good to add this on the mycetomas because they don't have a mycetomas. So like the MMV boxes, we will make a different map in this big spreadsheet of that.
Okay, so a different tab, you mean?
Yes.
Okay. I mean, if we do pursue any of these, if they're looking particularly promising, then we can add them to the myos list, I guess.
Yes, that would then only be those 6.
Yeah. Yup. Okay, that's interesting. I guess, yeah. I mean, we love to, yeah, we need to see what the structures are, but I mean, essentially the structures in our library are pretty druggable, I mean, in the sense that developable, right? So they are nice medchem-like compounds. So
yeah, and the smiles are in this table. So yeah, I cannot draw these things, but you chemists can. So
yeah, not from that. Yeah, but not yet. Maybe one day I'll learn smiles, but not yet. Yeah, we can convert them though, and when we've got the final compounds from the other stuff, we can also convert them to structures and find out what's what. But we'll wait for that.
Okay. Then I will stop sharing.
Great, sounds good. How many were in the kinase library again? Sorry, what's the size of the library?
Just checking if Mickey is here. No, we got the updated library, so it was a little bit bigger than the original library.
Under 100,
but I
isn't
don't,
it under 100?
Yeah, I think it was almost twice the size as the original one.
Okay. All right. I mean, 6 isn't bad. That's the thing. I guess we'll have to wait and see.
I would have expected a little bit more hits, but yeah, it's what it is.
Yeah, we'll see how diverse the structures are, and then we can take it from there. I mean, there's a bunch of things you have to do there, such as maybe order compounds that are like those to see if they are real hits in a sense, and check the structures for if they are in any way promiscuous hits. Check to see whether or not those compounds also are in some way generically toxic, which I guess we don't.
What Mickey also does for this project is that he looks into our expression data, both in the larvae and in vitro. We have expression data, and he will look up all the kinases to see which ones are expressed and which ones aren't, which will also help probably in the design or choosing which kinases to target.
Right. Okay, well, that's really exciting. Great.
The compounds from NEU, the series 3 Curaxins came, right? You said? So those are going to be screens?
Were series 3 already screened? I think they were not in the subset we screened so far.
No.
So series 3 is still to come.
Okay. It was the stuff from NEU, the Curaxins.
Yeah, that's down here.
Those are
somewhere.
yeah, those are similar in structure to phenothiazines, but they're a little bit more, I guess, nicer because they've been actually in trials.
For the, what's the requirement here for the merging of the list? Sorry, what's needed?
It's a CSV file. I'm not sure how to put it into the list exactly.
You
It's
should
on
be able to
the.
just upload a CSV file into Excel,
Oh, I don't have Excel. I use Linux.
or you can upload it into Google Sheets.
Maybe, I'm not sure. I'll have to figure it out. Yeah, I just not great with
Yeah.
spreadsheet software.
All right. I mean, if you can see if you can upload it into a Google Sheet, then we can take it from there. Should work.
That could work. Yeah, I could see if I can. Yeah,
Okay.
or maybe on a separate page, and then we can merge it. Yeah, it's all the CSV files on the main Series 3 repo. I backed it up, so we have that.
All right. So on that list, of course, there are a couple of phenoromols, and we'll have to see if those are because I think from Series 1. So we'll have to see if those need to be added to the paper. We've got the the situation with the final compounds that we were interested in Series 1, the phenoromols, which filled the SAR gaps, was that we'd identified the compounds and Epicam had responded about which compounds they still had and which ones were at TCG Life Sciences. So I think Louisa had arranged for shipment of some of those to Wendy's lab. And there were some others. So I think these ones had been shipped, and I think that's in process, right? So it hasn't arrived yet. It's in process. But there were some where there was no stock, and there were about 4 where the samples are there. But there's a bit of chaos going on with Epicam at the moment. It's a bit of a state of flux. So communications have been fragmentary, and I've tried to stay in touch with Jason Chaplin, who was my contact there. And I'm trying to get clarity about whether some of these 4 compounds can still be shipped, but no news yet. I'll maintain that though, because it would still be nice to have them. And we just have to see about the timing, about if the data comes through and they're useful for the paper and we need them in some way, then we can slot them in at the end there. But we just have to wait and see, and it's difficult to rush this. But certainly the ones that are being shipped now from TCG Life Sciences to you, Wendy, they could in theory go in if we have the data soon.
Yeah.
And no news from our Cameroonian collaborators. I guess I just need to do a targeted email back out to them to say they're still interested. Otherwise, we drop this and we forget it from the schedule. I'll try one more time to try and make contact. But yeah, these ones here that are mentioned, I think you put this here, Wendy. Are those the 2 that you just had on that spreadsheet?
Yes.
Okay, fine. Great. So we'll wait for the data. That's good. And then on the paper, let me just bring up what we've got here. So in the Dropbox folder, which I think we're still using as the place to share data, I've got a version of the paper that is that was edited on the 3rd of October. Is that the most recent one? Because that's the one that I've got here. Oh, is that the version that we should all be looking at?
Yes.
Okay, this guy here, right? So October 3rd, version 2.2.
Yep.
Yeah, is that all right? Okay, so that one, let me just open it up. Because I just want, let me share that. The screen sharing is a pain. Okay, yeah, so this is the paper here. So what's next here? Because I don't think it's on me at the moment. What's the next step or steps here?
So I was on it last, I think, based on just the date. So from the last time, I have corrected all of the experimental details. So just remove comment from my part for the experimental details. And I have updated the writings for the SAR sections. So all of the comments in terms of like match pairing. So I just need to assign pairs of MyOS compounds for the various comparisons. So I've done that. So I updated the writing. So that's what I was up to. I did see the concluding remark, which needs a section on the known structures, but I haven't quite got time to write that one yet. And I wasn't sure at the time what to do in that section actually. So that one was still there.
Yep. Yeah. So it's this thing, right? So it's the, I mean, in a paper you describe the data you obtained, and then you describe whether or not the data are surprising or different from the literature, and you place it in the context of the literature. So if we're talking about CYP51, we need to have some comments here from the team about, are our data in line with what we would expect based on the idea that they target CYP51. We don't have a modeling of that yet, right? But we can make some comments about how our data relate to what's already known against this target for other pathogens. I mean, we have to do that, right? Because that's how we relate what we're doing to the wider field. So we need some kind of comments in there. I mean, I assumed that you would be putting some of that kind of stuff in your thesis, and certainly for Dimitri, it's going to be essential for the thesis to put that in context. So what I was kind of hoping was that you could copy that over from your thesis into the paper.
Yeah. I'm currently still working on, not working on the synthetic section of my thesis. I'm working on chemistry education. That's why I didn't quite have the capacity to go back to do this yet. But seeing that we're quite close to just getting this paper out, I'll try to squeeze in some time to finish that one page off.
Yeah, great.
So I've already have the references on GitHub for those papers. So it's basically just looking at what's already there and try to summarize the paper, what's relevant to ours.
Yeah. Okay.
Those things that you mentioned about the paper, about the concluding remarks, are probably the two major points that are currently missing from my thesis introduction. So I haven't been working on the introduction. I'll be coming back to this after submitting you the experimental section. So this should be done next, I guess. The alpha fold is on the list as well.
Yeah. So the section about relating
action, of course,
to the literature is about taking the R&D section, and then it's the discussion part, right? So it's linking what we found to what other people have found, and is it that our results are in line with that? Have we got compounds that are similar to what's already known to target CYP51, and is the SAR data in some way reminiscent of that, or are results different from that? It's an explanation to the reader who doesn't know this field very well, whether or not our results are in any way surprising, or if they're completely in line with what we'd expect, right? So we don't need to do any modeling for that. We can just do.
I guess most of the data on CYP51 would be looking at the azoles.
Mm-hmm. Yep.
Because there should be data on azoles and CYP51. There are a lot of azoles out there and with different structures. So maybe somebody already looked at that with the azoles in CYP51. That would, for me, be the most logical place to look at.
Mm. Yeah, agreed. So, but the comments on the right here, can we try to get rid of these and resolve them, or ask a further question, or so that we have a clean version where the comments have been dealt with? Because at the moment, we can't submit with these hanging questions, so we've just got to get rid of them, and make sure the manuscript's corrected. Yeah. So if something needs to happen, then.
Matt, the agreement was that we would do as much cleaning as possible, and then you go through the manuscript again, and this comments that are left over are something that has not been resolved. At least that's on my part, where I replied to you, like you asked a question, and you promised that you would look back at this. So I don't know whether that's still pending or just good.
Yeah, I mean, either the comments, you know, a response to them that clarifies why something might be the case, or them being resolved in the manuscript just to get rid of them. We just need to get rid of them all, right, before we can submit it. So if you can have a look at anything that's still there, and then if there's anything remaining that we need to take care of or to discuss, then we should discuss it. But at the moment, there's just quite a few comments, I think, that are unresolved and need to be fixed. So if you can work through the experimental here and generate a clean version where everything is taken care of, that would be useful. For the numbering here, Hung, yeah, I mean, these, if we're going to give compounds numbers in the manuscript, then eventually we're going to have to replace these with actual manuscript numbers, right?
Yeah, the problem that I encounter when I try to change the like the MycetoS dash coding to use that as the actual code for the paper is that if you some of these are intermediate, so they're not in the master list. So if I'm going to use intermediate 1, then I can't use 1 because 1 means MycetoS 0001, which is so that's why I currently my solution is to put it as an intermediate or INT 1, 2, 3.
Okay, I mean, if these are, that's fine. If you want to use that, then we can use that throughout the manuscript. Is that what you're saying, or is this a draft?
The intermediate is actually not screened, so so that's actually will be a part of the like the SAR or all of the other stuff. Only the MycetoS compounds are the one that are screened. So that's the distinction between the two.
But in the paper, do you want to maintain int2, for example, or do you?
I don't know what's the best option. That was just something that I put there as a suggestion. Just keep it as an intermediate 1 instead of 1 because 1 means MycetoS 1 in this context.
Yeah, sure. Yeah, I mean, we can do that as long as it's consistent throughout.
Yeah.
And I'm assuming they don't appear a lot in the diagrams used in the paper, right? So it's
not at all. Not at all. The intermediates are not screened.
Right. Yeah, but they're also not in the synthetic diagrams, right? So
no, they shouldn't be.
So it doesn't matter too much. So we can probably do that.
Why can't we just use simple numbers like 1 to 50 or whatever it is? Because if you look at the top, at the title of each compound, it has a number and then a MycetoS code before that in the brackets.
Oh, that's gonna go away. Yeah, that's gonna go away soon.
It's gonna go away.
Yeah. Because we define the bold number in that paper as MycetoS code, like simplified MycetoS code. So it can't be It can't be 1. You can't use intermediate 1 as just 1 bold because that means it is the compound MycetoS 000.
Right, but in the paper itself, we're keeping the MycetoS codes to talk about the molecules, right?
Yeah.
Yeah. It simplifies a lot. It means that you can go from the paper to the live project and not get confused, which is helpful. All right. I guess so. If Hung and Dimitri can look at the experimental section and try and get rid of any hanging comments that are still there, that would be great. Anyone else? You want to take a look at the rest of the section, on the SAR bit, that would also be really good. And hopefully at some point we can have some comments here about comparison of what we're doing with the literature, and then we'll be ready to submit this thing, but we need all of those different components before we can do that.
Yeah.
All right. All right, and then so on the side, I think that's everything on the phenomals. On the siderophores, yeah, it sounds like you guys in Erasmus have been busy with testing the fluorescent siderophores, and you've got data that might be coming. Is that?
Yes, so we tested them in the larvae, and we made all kinds of pictures to see if they were taken in by the grains, and that data is currently analyzed because we used the fluorophore itself as a control, we used the siderophore as a control, and we're also double checking it with in vitro experiments, but we faced some issues with autofluorescence in the fungus. That's why we need to take a very good look which is autofluorescence and which is actual fluorescence by the siderophore.
I uploaded to a new sheet, the Curaxin Series 3 stuff. The data I had, just the names and the stuff.
Oh, you mean, sorry, is that a series? Is that a series 3 thing?
Yeah. I uploaded
The thing we were just talking about?
Oh no, sorry, I just was doing that. We were talking about the siderophores. I'm sorry.
Yeah. So sorry. Yeah. The data for the siderophores will be incoming, but there's a potential problem with autofluorescence.
Yes.
Okay. All right. Are you able to factor that in the results? Is that going to be based on the different wavelengths?
We created in the past also a GFP Madurella, and there we could also see the difference when we played with the settings. So you could see the GFP was more powerful than the autofluorescence.
Okay.
So I have to sit with Mickey to look at the data to see how we can work with that.
Okay. Great. All right.
There are other proteins that glow two different colors, like M cherry and such as those that could be used as well instead of GFP.
Yes, I know, but it's usually the blue which gives less autofluorescence, and there are not too many dyes in that.
Ah.
All right, and then series 2, the aminothiazoles. There was a schools meeting. Clementine is not here today. Well, I guess people were talking about which molecules are going to be made where and how. I don't know if you were there at that meeting, Erica. Did you want to say anything about targets coming up from that team? I guess I didn't see any minutes from that meeting, so I wasn't quite sure what the agreement was. Do you have anything?
Was it the one last month?
Yeah.
Yeah, I think that meeting we focused more on the series 3, the discussion of what molecules to synthesize next. I don't think we discussed anything on the aminothiazoles.
Okay. All right. I think I think we need to catch up with Clementine about that. Because there was it was meant to be who was making what. So there was some stuff from her and Julia from York, and I guess maybe us at UCL, but I think we need a separate update about which targets are being taken on by whom, just to make sure that it's all agreed on and everyone knows what's going on. There were some issues, I think, with the most recent entries in that series, going to Rotterdam, but they didn't have MyOS codes, and so there was some confusion there about what was what. We just got to make sure that if there are targets and if they're being sent, that we schedule how they're being added to the master list in a way that ensures we don't duplicate. Because I think there was
I tried to check for duplicates using the SMILES codes, but it didn't identify the duplicates most of the time. But it's probably, I generate the SMILES with ChemDraw, but it didn't identify the duplicates. It was based on what I remembered from, the actually seeing the structures that I put potentially this is a duplicate.
Erica, hi. I just a quick remark. I actually figured out what happened there. So by chance, me and you, we have duplicated the MyOS codes. So the batch that you submitted to me for the biological assay for the shipment back in August, you numbered them with MyOS codes, but you did not add them to the master list. And by chance, I was adding new molecules to the master list, and that's how we ended up with duplicates. What I did is I renumbered your compounds, and everything that's on the master list now is correct, and there are no duplicates. And I notified Rotterdam, Erasmus MC on this as well last time. Yeah. So hopefully there is no confusion. When have you managed to figure it out by now?
Yes, that's part why also the screening is not completed yet, because we needed to figure out each compound which was what. We could see that they were different because they were different colors than the same code had different colors. So that's how we noted that they were not the same compound. So what we did on the files themselves, we also change the MycetOS code to how they are currently in the spreadsheet. Otherwise, maybe if we need to rescreen something in a year from now, then we wouldn't know which one is which. So to avoid us to have to renumber MycetOS codes, which is prone to mistakes, even if you cannot upload everything in the list already, just claim the MycetOS code, but putting your name after it or something like that, so that nobody else can use the same MycetOS code, because we're not chemists, and we were lucky that these molecules really look different than the same from the other codes. Otherwise, there might have been some mix-up, and then we would have positives, which were, for instance, Erica's compounds instead of Dimitri's, while it should be vice versa.
Yeah. For compounds that are duplicates, where the same molecule has been made, the numbering convention we have does account for that, right? And that's one of the intentions of that system, is that there are batch codes as well that can be used. So the same MycetOS code with a different batch code can be used. So, you know, a new version of the same molecule doesn't need a new MycetOS code. Just to highlight, because that will also be very confusing. So that's where these long codes come into their own, which is why we use things like this, so that you can see that salt information and batch information. And the first thing is the unique identifier for the molecule itself. Just FYI. All right. Okay. Well, so I guess we'll try and get an update of who's doing what. There has been so Clementine has also uploaded a suggestion of how we can deal with this issue of keeping track of who's making what. And you can follow that here. There's a link to it that she's provided on the issue for the meeting. And essentially relies on something that we tried to do in open source malaria as well, which is where if you're making a molecule, you put it up on an issue on the relevant wiki, and you tag it with something which says it's being made. And that is a simple way of doing it. So then you can search on the tag and it reveals all the molecules that are being made. In open source malaria, we had a problem with people not keeping that up to date. And so when a molecule was abandoned, you know, they didn't close the issue or remove the tag. And sometimes people didn't put the molecule up when it was being made. So it's also subject to human error, obviously. But it is an easier way of showing that you're making something, because of course you can just draw the molecules and put the smiles code, dump them on an issue, and put the tag there without having to edit the wiki all the time. So that is a nice way of doing it. So for those of you who are interested in that, and that will be all the people who are contributing to the Series 2 schools project, the crowdsourcing aspect, please do have a look at that. Could be an easy way of sorting that out. All right. Okay, and then on the benzimidazoles, yeah, there was an oxazole testing of this compound. I guess that data also will come in the next upload. Information about this hit, hopefully. And ditto for Series 6. The latest results will come when we have the data to be uploaded from Rotterdam, I think. And there's the KCGS. Walid, the connection that we have with Walid is through you, is it, Wendy? I don't think I've ever had any direct connection with Walid, but I'm not sure if I have any email, but maybe I'm misremembering. Was that a communication with all three of us?
Yeah, we both spoke to him to give him suggestions. So right. I will take this action item to email him one more time to see if he's still interested.
Great.
Because
thanks. Perfect.
Yeah,
all right,
I think
great.
it's
Thank
good
you
to ask that.
Yeah, absolutely. And then the last thing, yeah, we sent the compounds for DMPK to Dundee. We don't have any data yet, right? Unless I missed an email. No updates yet, I don't think. But it is end of October. I think we're due to get some data from them. So I can take that action to chase that offline, because it would be nice to know if we've gotten any data thus far. Obviously, it'd be useful for the paper. All right. I think that was everything. I'm going to try to be in Geneva on Monday. It's a trip to see MMV, but I'm trying to get some time to go and see people at D&DI. So I might try and pop in and see Louisa and talk about the project if I can. If anyone has anything they want me to raise, apart from the fact we need lots of money, then please feel free to send that through. All right, I think that's everything we, yep.
With respect to D&DI, there will also be a meeting on preclinical screening that will be in November. So I will take MycetoS further there too, to lobby for MycetoS too.
Great, that would be good. Yeah, I hear on the grapevine that it may be the case that Wellcome is maybe getting more interested in neglected tropical diseases as it used to be. If that happens, if that's the case, then that would be obviously another good place to go for funding. All right, and
Yes.
any other bits that we haven't dealt with?
No, so I just put the CSV file, I uploaded it to the sheet. So there's a page called Curaxin Series 3. Just wanted to tell you guys that so that you guys can get MyOS codes. And
great, thanks. Somewhere there, can you put in the sheet that, because we'll forget, that the sheet needs to be merged with the master list?
yeah, I did. I'll do that too. I'll put a note. Yeah.
For the testing that's going to happen, though, those molecules will need MyOS codes for the testing. No, they've been shipped already. Do they have MyOS codes, or are they MyOS codeless?
They don't have MyOS codes. They have NEU internal stuff, which is what Lori sent them labeled as.
Right. Okay. So the vials are going to arrive in Wendy's lab with just NEU numbers and not MyOS codes. Is that right?
I believe the package has already been delivered.
But there's no MyOS codes in there, right? So we'd have to do that before the testing, ideally.
Yeah, so we have those and we are screening them on the current codes. But it would be great if there's MyOS codes, because then we can upload the data too. Right.
Okay. All right. So when you get the data, then okay. I mean, for the most, it's messy, but for the moment, yeah, just use the NEU codes, and we'll deal with the MyOS codes ASAP. I don't know who's going to do that, but hopefully we'll find a way. As long as they have a unique identifier, that's the main thing.
They're on a separate sheet. They have the unique NEU.
All right. Any other business? For the meeting timings, yeah, we need to create. So we have a meeting in November, and then we may not get one in December just because Christmas is in the way. So we will need to come up with another set of meeting times for 2024. And so that's an opportunity to mix the timings a little bit, because I think for the Sydney contingent, it's really awkward. So I mean, I'm very happy to shift earlier. That does then make it difficult for people the other side of the world. Or as you said, we mix the times. Either is fine. I think so long as we just have the Outlook invites, then everyone knows exactly when it is, and we're not vulnerable to time changes and things like that. I've got no preference. If anyone's got a preference, please say how we want to do this.
Well, I can make the Outlook invites, not a problem. I know that in the past we had those alternating schedules, so that at 1 month it was ideal for Sydney, and the other month it was ideal for the United States. So we can take a look at that, and maybe it's good just to make that I check with the timings which would be perfect choices, and make a sort of poll on GitHub so that everyone can show their preference, and make it alternating. At least for the winter months, because the summer months, then Sydney changes a different direction as we.
Yeah. I mean, I'm happy with this time, obviously, and any time in the evening, like 8 or 9 or something, is usually fine if that works for Australia. So we could alternate in that way.
Yeah, I think if it works before, then I'm happy to just have that again. If that works with everyone as well.
Yeah, I think that the last time, are there now also from the western parts of the United States people joining or not?
Not so much,
Because
I think.
no, and so I can take a look, because usually the eastern part of the United States, Sydney and us, there's more playing room as that when you also need to include western parts of the United States.
Yeah, yeah.
So I will take a look and propose some timings, and then we simply make a poll who likes what best.
Yeah. All right, great. I'm easy with the timings completely, so whatever seems to work for the most people.
Okay.
Yeah, I mean, I guess historically we've had more engagement, you know, in Europe and as the main source of inputs to these meetings, I suppose, statistically speaking. But obviously, you know, we want to try and make it easy for the Sydney contingent to be involved and come to the meetings. And it will be obviously great to be able to reach out to any teams in Africa, like the Cameroonian team who want to get involved. Those seem to be the main ones historically, rather than West Coast US, which hasn't usually been a big attender of these meetings. All right, yeah, I mean, anything you can do there, Wendy, would be fantastic. And yeah, if you're able to send out the outlooks before the end of the year, kind of thing, then we'd have them all locked in.
Yeah, my aim is to set the time before next meeting on November, so that we can have a final discussion or vote on it, right, so that by the end of that meeting, I will simply make the Outlook invite in December to distribute it before December.
Great. Okay, sounds good. All right. Fantastic. Well, speaking of which, the next meeting is the 27th, I think, November 27th.
Yes.
Yeah, at the usual time. Chair is UCID and we're the minute taker. All right, awesome. Thanks. Well, thanks for coming, everybody. Happy Halloween, and see you in a few weeks.
Yep. Bye, everyone. Happy Halloween.
Bye.
Bye.
Bye.